Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Sputum in bronchial asthma. In bronchial asthma, the macroscopically the sputum looks worm-like. On macroscopically, on seeing from outside, it looks worm-like, but on microscopy, we will see that the sputum contains eosinophils because bronchial asthma is an allergic manifestation. Eosinophils are present in the sputum of bronchial asthma. Desquamated epithelium will be present. There will be Kirschmann spirals or whorled mucus plugs are seen. These Kirschmann spirals or whorled mucus plugs, that is the mucus which is formed, will produce a whorl-like structure resulting in the Kirschmann spirals. Then charcoal-laden crystals will also be seen here. So even charcoal laden crystals can be seen, and even the cryola bodies are seen. Charcoal laden crystals are the crystals of eosinophilic protein which is called as galactin, whereas cryola bodies are the exfoliative cells which are seen mainly due to the disruption of mucosal integrity. That is, whenever the mucosal integrity is lost, the superficial layers of cells starts to degenerate and they will be exfoliated in the sputum. Those bodies of superficial epithelial cells which are seen, they are called as cryola bodies.
thank you and thank you for watching.